All right, I'm going to call the Tuesday, August 5, 2025 JPS meeting to order. For everyone who's talking, we can start. Take a roll call.
Member Childress?
Yes.
Member Desart? Member Eka?
Here.
Member Evans? Member Heather? Member Hone?
Here.
Member Krajewski? Member Ozog? Member Shorzy? Member Tornator? Member Yu?
Here.
Member Zay?
We have a quorum. Is there any public comment? Good day. All right, I would just like to make a few comments. First of all, I'm not Chairwoman Evans. She's not here today. She is in Springfield. She's due to be here. She's not here due to being selected to be an Edgar Fellow. I don't know if that's like a good fellow or something like that. So there's a lot on the agenda today, so we'll dispense with the rest of my comedy act and move forward with the the agenda. So is there a motion to approve the minutes of the June 17, 2025 meeting? Moved in second. Any questions or comments? Hearing none, all in favor say aye. Opposed? Passes. There a motion to approve JPS 3225 recommendation for the approval of contract purchase order to Axon Enterprise Inc. for the purchase of Axon Body 4 camera bundle for the Sheriff's Office for the period September 1, 2025 through November 30, 2028 for a contract total of $625,198.30. Moved. Second. Any questions or comments?
Thank you, Chair. So I remember that we purchased these cameras before from Axon, and I know that this is an additional number of cameras, and I'm just wondering, like, what department? Why do we need these additional
I think
cameras?
it's going for courthouse personnel.
That is correct. This is for courthouse security officers. I'll let Deputy Chief Billadu correct anything I might say wrong. But what it is as of December 1st, the Sheriff's Office will be taking patrol of campus from resting and such. These cameras are needed for those court security officers if they respond. If they leave the building where the cameras are, they're required to have a body-worn camera pursuant to the Safety Act.
One more question. So I do know that there's a shortage of court security officers for these people that we are outsourcing, or is this actually from the Sheriff's Office?
These are the actual deputies, court security deputies.
Thank you.
Deputy Chief Billadu, did I miss anything on that?
Nope, you got it all right. Thank you.
He may not be on, but I believe that to be the case.
I think it's also court security.
Yes, court security officers and deputies.
Thank you.
Any other questions or comments? If none, all in favor, say aye. Opposed? Passes. Moving on, is there a motion to approve JPS 3325 recommendation for the approval of a contract purchase order to Heartland Business Systems to provide 40 SOC AAS for the Sheriff's Office for the period of August 5, 2025 through August 5, 2028 for a contract purchase order not to exceed $301,738.65. Second, any questions or comments? Hearing none, say aye. Opposed? Passes. There a motion to approve 25-1795 recommendation for the approval of a contract purchase order to Image Printing Inc. for 2026 case jackets for the Clerk Circuit Court's Office for August 5, 2025 through June 30th, 2026 for a total contract amount of $16,456.75. Moved in second. Any questions or comments? Hearing none, all in favor say aye. Opposed? It passes. Is there a motion to combine agenda items 7A through 7F, all of which are acceptance and appropriation of various grants? Move the second to combine. All in favor say aye. Opposed? That passes. Now is there a motion to, I'm going to read them all off. The resolutions FIR 117-25 acceptance and appropriation of the Illinois DCFS Children's Advocacy Center in the amount of $348,207. FIR 119-25 acceptance and appropriation of National Forensic Science Improvement Program in the amount of $171,088. FIR 121-25, acceptance and appropriation of the Victims of Crime Act Child Advocacy Center Service Program Grant in the amount of $67,740. FIR 122-25, acceptance and appropriation of the Violent Crime Victims Assistance Program for fiscal year 2026 in the amount of $37,825. FIR 123-25, acceptance and appropriation of the Missing Pieces Grant fiscal year 25 in the amount of $25,000. And finally, FIR 124-25, acceptance and appropriation of the Illinois Family Violence Coordinating Council fiscal year and the government agreement in the amount of $49,000. Second, any questions or comments about any of these? Favor say aye. Opposed, that passes. Your motion to approve budget transfer 25-1832, the amount of $25,000 for unanticipated overtime due to the cyber event. Any questions or comments? If none, all in favor say aye. 25-1833, transfer funds from the temporary salaries account to the grant services account to cover actual revenues paid into the funds disbursement in the amount of $12,719. Motion. Second, any questions or comments? If none, all in favor say aye. Opposed, that passes. Your motion to combine, receive, and place on file informational items 9A, B, C, and D. Second, any questions or comments? Sir,
Thank you, Chair. Yeah, I just want to start a conversation about proactively what we can do about this. I just noticed that from April to June, I looked at felonies, misdemeanors. They went up 33% in the county in those 3 months. So I just wanted to open it up, wondering what we could do. If there's a challenge, there's got to be a solution to crime in DuPage County, and just any way that we could act proactively to, thank you.
the public
Jason.
defender is here.
Is that directed to Mr. York specifically?
No,
or
it's
just a more
not.
Broader statement.
It's a broader statement for JPS, Sheriff's Office, courts. I don't know. I just noticed that it went up 33%, and I'm wondering what we could do to cut down on crime. Thank you.
Say anything, Mr. York? You want to wait till your budget presentation? Okay. Is that okay if we wait until 1:30? Any other questions or comments? Hearing none, all in favor say aye. Opposed, that passes. Now we'll move on to fiscal year 2026 budget presentations. Our first presenter of the DuPage County Coroner, Judith Lucas. Said that right? Hi, how are you?
I'm fine. How are you? Good morning, everyone. I'm Judith Lucas, DuPage County Coroner. I've got my budget for 2026. The first slide, we're talking about the general fund expenses. The only expense that I have added is I have increased our salaries. Our employees are underpaid. I started doing a deep dive in it, and HR did a market analysis after I saw one of the DuPage County Animal Control Officer postings was $4,000 a year higher than our deputy coroners. So as much as I had wanted to increase our deputy's salary a little bit more than I have proposed, after talking with Jason Blumenthal, I've actually cut this back a little. So the budget will show, I've been able to reduce what I've presented. These are the numbers that I originally presented by between $100,000 and $150,000. So what you see here is what originally proposed, and then after that, we've cut some back. So in addition to increasing some salaries, I also had asked for an increased headcount. So the first page with the general fund expenses is just what is required statutory by us, by the state of Illinois. And with our coroner fee fund, we're picking up our other expenses. Next slide. Our general fund revenues are we're transferring from the coroner's fee fund into the general fund to pay for some of the expenses. Next slide. Coroner fee fund expenses, and this is everything that the county does not have to pay for. This goes from all of our utilities, maintenance on the building. We have a contract, we have our own x-ray machine, so it covers the contract on the x-ray machine, our washer and dryer. We do all of our laundry in-house. And again, this does not go on to the taxpayers. This comes from the coroner fee fund expenses. The next page is our coroner fee fund reserves. And that's coming from our cremation permits and our other fees for copies and FOIA requests. The next page here. So if you look at the overtime expenses, we will be going over this year. So I have increased it next year by 50,000. I'm hoping with the additional headcount, we're not going to need it, but because it's a budget, I have to, plan for it and then hopefully not use what we planned. But if you see last year, if you look every year from 22 forward, the amount of overtime used has gone over the budget. And this is my first year in office. So the budget was $65,000. That was not a budget I made. And so we will again exceed it. If you look at the year before, it was exceeded by 100,000 over just on overtime. And that's what I want to reduce. So I did ask for a $50,000 increase in that as a cushion. So we're not going over. And I'm hoping with the additional headcount, we're going to be able to not even, make that extra 100,000. Next slide, or the extra 50, I should say. So a very slow loading slide. So the last time our office had a headcount was in March 2008. The previous year, in 2007, there were 3,780 death investigations, and that's when it was increased to 10 deputy coroners. In those 17 years since, 17 years since, I had to look at my numbers here. In the 17 years since, we've had a 73% increase of death investigations. So we went from 3,780 to 6,549 death investigations without having an increased headcount. And that's why we need it. I originally, part of the money I was able to save from what I had initially submitted is because I did ask for a 2-person headcount. We have 12-hour shifts. So the scheduling with just a 1-person headcount increase will be difficult. But again, after talking with Jason Blumenthal, I'm going to be creative and we will try this. And I'm hoping that I've had discussions with some of the deputy coroners talking about our senior ones because they've been there for years and they were there from when there were 24-hour shifts. And I think we'll be able to get by with the 1. And like I said, in addition just to having the 1 head increase, we will also be able to reduce that over time, that extra cushion that I built in. And then, so in addition to be short-staffed, from 2020, January 2020 through today, we have had a 140% turnover in deputy coroners. So that means we have seen and lost 14 deputy coroners when we only have 10 positions. So part of that is from low pay and short staffing, and I need to reduce that. 2 of our deputy coroners are retirement age. Our office is unique. We don't send people to like a formal university for training. So much of it is on the job, and we need to retain our employees. If we don't, we won't have, once our senior employees retire, we won't have anybody experienced to train the newer ones. So that's why it's important that we increase the pay and that we increase our head count. And it's a difficult job. We're not attracting qualified candidates because the pay is so low. And back in the day, the coroner's office pay used to be on par with the sheriff's office. Throughout the years, the sheriff's office pay has excelled and the coroner's office has not. So anyone coming into law enforcement will see this as a stepping stone, and it's a way to get into the field. And then once they've, wet their feet a little bit, then they're going to transfer to another office. Or we get people that didn't realize how difficult the work is and all the biologicals that are involved with it. And they decide that it's just something that they can't do. Like I said, if they can get a job as a animal control officer for $4,000 more than a deputy coroner, why would they come to our office? So any questions? Yes.
Thank you. Thank you for coming in. A couple questions. You have a union there, right?
Yes, we do.
So why haven't we heard anything from your union about being underpaid all these years? I mean, there's a collective bargaining process.
There is a collective bargaining process. I've had a lot of discussions with people in my office, my chief deputy who just retired a month ago. There have been a lot of discussions. Can I tell you for a fact? No, I'll tell you the feedback I hear. The feedback I hear will be anything that, we have HR and we have the coroner both at the bargaining table. So, they'll say, well, the coroner won't let us do this or HR won't let us do that. That's only feedback I have. I haven't been at those tables. And even though there is a collective bargaining agreement, that doesn't mean it's fair to the employees.
Well, this seems to be a theme, and I'm going to
Sure.
maybe stick up for the board here a little bit, but over the last 5 years, we've given 18.5% raises to the staff here in the county. I mean, I can tell you, being in the private sector, that does not happen in the private sector. And on top of that, we haven't increased anybody's insurance over the last 5 years. So, I mean, this theme that we're getting from our county-wides that everybody's underpaid, come into the private sector for a while and see the benefits you get and everything else that's a whole, the days off and vacation and insurance and everything else. And then we're underpaid. I mean, I don't understand. I think we're doing our part by 18.5% raises over the last 5 years. I mean, it just seems to be like, we don't care. We don't. We do care. I think we've been giving fair raises. We gave a 4% merit a couple of years ago. I mean, I think this board has done a lot with what we have, but things are going to get tough again because the federal money's,
Right.
dried up. But to come back and say, well, we don't make enough or they're low paid. I mean, again, we have unions, we have other contracts, we have negotiations.
Right. I understand.
mean, that's part of the process.
Yeah, I understand that. So these numbers didn't come out of the air. They came from a market analysis. Lake County, who is comparable to us, they have 8 deputy coroners for 700,000 population. We have 10 for over 900,000. Their deputy coroners work just 8 hours during the day, and then they have mandatory pay in addition to that because they're taking on call, and they're also, so it's on call, like a set hourly pay plus additional on-call pay. So not looking at their on-call pay or their additional visits, for their Monday through Friday 8-hour days, they start at $62,000. We start ours at $47,900. Yes. And if we go to Will County, they're not as high as Lake County. They're also about 700,000. They have 17 deputy coroners, 17, more than twice as many as Lake, and proportionately twice as many as ours. They work schedules like firemen. They work 24-hour shifts. They only come into the office for 8 hours out of those 24 hours, and then they have the next 2 days off. So out of a week span, they're in the office for approximately 2 8-hour days.
Mr. Can I just ask how many people have left the office since, I don't know, this year?
Yes, we've had 3 leave.
All right, I just want to keep moving along since we have one more presenter after this, Mr. Krajewski.
Thank you. You're gonna send us that analysis.
I sure will, yes.
So I noticed in here that, since 2022, the budget for payroll has been pretty much exact. And the actuals hit the budget, which means we haven't had very many open positions at all, because we seem to always come right almost what budgeted for positions. So if they did lose people, they got them quickly filled. You mentioned overtime was going to be over this year, except it says it's projected to be what we budgeted for. Are those projected numbers just not right? Throw them in there, or
You
looking
said,
at the 25 projected, and it says you're projecting this year to finish at 65,000 overtime, and that's what we budgeted. But you did say that we're going to be way over in the overtime.
well, I didn't say we're going to be over, way over.
Okay, you're going to be over.
Yes. And,
That's not what you said here.
oh, pardon me?
That's what you said here. So we have 3 open positions. Are we?
We don't have any open positions.
That's just 3 people just left.
3 people have left and they've been replaced.
So, but is overtime going to be up this year?
Over the projected 65,000, yes, there's a chance of it.
Are any of these other numbers under the projected? I don't know how you came up with them. Usually that's what you project the year to end at.
Well, the
I've been
project,
having an issue with not just you, but all these ones. I'd like to know when we come here, that when it's projected is what they really think today, the end of the year is going to finish at.
right, I understand. The projected expenses are generated by the OpenGov software. That is,
See, that's a problem we're having here. I mean, for us as a board, we need to know what this year is going to finish at, what your best guess is today, what
right,
it's going to finish at. And clearly, one of the easy ones is payroll when things are open.
right.
You're saying OpenGov, they're saying no. You're saying it's over, but yet you don't have it over here. You have it.
Okay. I was told that it was OpenGov software, so if that's incorrect, I apologize. Part of the reason
My
why,
question is any of this correct in this column here? Are we thinking we're going to finish what we think it's going to be? You're going to finish at 2.1 million, or
Okay.
is it going to be down, less, up?
okay, well, let me address that. Part of the reason why the budget has been close on salaries is because our office is unique, where we can transfer money from the coroner's fee fund.
This projected column 2025, that's where I'm right at now. The projected 25, do you think these numbers are where your office is going to finish at, or we just found out, I mean, overtime's not right.
Maybe we can clarify that at the 11:30,
Okay, but
because it
this
sounds
is
like
the-
it's a
Yeah,
question.
This is something I've been asking, like,
Right.
they were giving them to us in May, but we get a presentation
I
in August.
understand.
Right.
That's for all the other.
Right.
different
Every month,
departments.
this thing should be changing. So next month, if somebody comes to us, that should be whatever they think currently we're at,
All right.
and we're gonna finish
I
at.
got
in a
one more
month.
question from Ms.
Yeah.
DeSark before we start our next presentation.
Thank you,
Alright, why didn't
Chair.
Get mine done,
I'm sorry.
but that's fine, just move on. But I mean, we have a huge increase in payroll. I'm trying to understand where we're at, and where we're going.
Well, I think
Clearly, the
maybe,
numbers here aren't right.
and maybe staff can clarify that when we start the 11:30.
Okay, thank you, Chair. Thank you, Coroner, for your presentation. I really appreciate the transparency. And that's what this whole budgeting process is about, sharing your needs with us so that we can fill your needs to make your office run smoothly. And I'm going to disagree with one of my colleagues. I mean, talking about increasing the salaries of your staff. We've done that over the past 2 years in almost every department in this county. We've looked through, we've done the research, we've given pay increases to sheriff's deputies, animal services, all the departments in DuPage County, and we have not looked at your department or your office. And so I think that our job is to retain the most talented people. And if you're losing 140% of your staff, we need to figure out a way to retain them Training costs a lot of money, so let's keep the good people we have. And again, I appreciate your transparency, and I don't think you're out of line at all by asking for advocating for your staff. Thank
Right.
you.
Thank you.
All right, anyone else? All right,
Anything else?
quickly. Nope.
Nope.
All right,
Okay,
we'll move on with Homeland Security and
Thank
then if staff can address Mr. Krajewski's comments prior to the start of the 11:30 special call meeting. I'm sure you're all be at.
Good morning, Vice Chair Eckhoff and members of the County Board. In addition to the documents you already received from the Finance Department, the slide deck will be sent to you after this or following this meeting. Next slide, please. OHSCM's purpose is to make for a safer, less vulnerable, and more disaster resilient county, and to provide for a safe and secure government center campus. Next slide. We do that with 13 full-time personnel, about 22 full-time equivalent contract security officers, and 20 dedicated and skilled volunteers. Let's stay on that slide for a minute. Here's the most important information up front. My FY26 budget request is 1.3% less for our emergency management operations, 13.6% more for security operations, and has a net department increase of 7.1%. That is $140,000 more than the 1.9 million that the board approved for FY25. The next two slides will detail the budget request for our emergency management operations and are followed by two similar slides for campus security operations. Next slide. First, with respect to our emergency management operations, I'm requesting about $11,000 less than in FY25. And that savings is due to not having to outfit 2 vehicles in FY26 and by making small adjustments to various accounts while keeping our revenue unchanged. And that revenue that I mentioned is from the Emergency Management Performance Grant, or EMPG, which all Illinois counties and accredited jurisdictions receive annually based on population and by meeting certain state mandated criteria. We anticipate the amount will be unchanged from FY25. Next slide. Regarding our FY25 projected and year-to-date actual amounts, they are on track with our with our approved budget for this point 8 months into the fiscal year. Where that is not the case, it is due to items that are either invoiced annually, for which we have not yet been billed, or for items that we don't know when or if they'll be needed, such as vehicle repairs. In that case, I budget based on a rolling average historical expense. The one exception to that is our projected salary expense, for which the actual amount will be about $132,000 less than budgeted. This is due to difficulty we had this year in filling open positions because of market competition and for hiring pauses while we assessed the department's needs. However, I am pleased to report that as of last week, OHSCM is fully staffed. Now I will review the campus security budget request. Before I do, I want to acknowledge and thank Chief Keith Briggs for his many years of professional contributions to the county. We have a few more weeks before Keith retires, and I am sure we'll have another opportunity to acknowledge his service and friendship. Next slide. For our campus security operations, I'm requesting about $151,000 more in FY26 than the 1.1 million we received in FY25. This is due primarily to our security contract and for these two reasons. First, last December, the health department began paying its portion of the security contract directly to the vendor. As such, OHSCM's reimbursable for FY25 is less, but its security contract expense is also less by the same amount, so the net effect on our FY25 budget will be zero. For FY26, the health department will manage its own security contract. Next slide. Second, our current security contract expires on November 30th of this year. An RFP is on the street for a few more days. Subject to the board's will, on December 1st, a new security contract will be in place with what we anticipate will be an increase in rates. Not counting these two changes to our security contract expenses, the remaining variances are small and total less than $500 overall. In 2026, as we periodically do, I will work with our Human Resources Department to conduct a needs assessment and salary study for our security staff employees. Next slide. As many of you know, the Federal Emergency Management Agency, or FEMA, has been the subject of much discussion as to whether it will exist in its current form. One clear direction given by the administration is that more of FEMA's federal duties will likely be distributed down to state and local entities. OHSEM will continue to provide planning, training, and exercises locally and regionally to municipal partners. We will continue to provide communications and operational support to and coordination of large-scale disasters and planned events, such as the 2026 President's Cup, for which we have been working closely with PGA Tour and Medina Country Club officials for many months. Thank you for your continued support of our department and our service to the community.
Thank you. That was very, very high level, and I appreciate that. I want to get into the weeds for a minute, and I sent an email out last week. I just didn't hear back. Regarding hiring staff, I noticed that there was a male hired, and a female hired, same job title, same class. I believe it was 2332. I could be wrong, but same title, same class. But the male was hired at $3,000 more, 88,000, and the woman was hired at 85,000. Can you explain what the difference is? Same job title, same position, same class, different for the male and the female.
Chris, the head of our HR, Chris, I think was trying to give you a call. Maybe she didn't connect with you. But as far as a discussion of hiring different individuals, I think that would be best not an open session. But we absolutely have an answer for you. And Chris, I will make sure Chris gives you a call or talks to you today.
Okay, I will definitely try to reach out to Chris today. I will say that I did not identify either individual in any way, so I didn't give out any private information. I didn't name them or talk about what the job title was, but I'll wait and talk to Chris privately. Thank you.
All right, Mr. Krajewski.
Generically, I mean, we have a range. I mean, our ranges are very big. That's something we haven't visited since 2008, but we have a range of, say, a position is between 50 and 80.
Yeah.
And then when they look at them, you can slot them in based on their experience.
That's exactly right. Generically, I can tell you that when we hire people, we will not necessarily, there's a range and it's based upon their past experience and what they have for, education, work experience, and what they bring to the thing. And that is, so you can be slotted in anywhere in the range based upon the work experience. But specifically what you're talking about, Chris can give you those, that answer, but you are absolutely correct.
Right, any other questions? Any old business? Mr. Zay?
Yeah, I know that the chair's not here, vice chair didn't have it, but I don't know why we needed to do 5 budget presentations all in one day for some pretty big offices. I mean, the chair's budget's not going out until the end of September. I thought we had plenty of time to do that, but we try to jam it all in one day.
I'm just playing the hand I'm dealt. But we can always have them back, I suppose, if we have more questions after today. And I'm asking staff to address Mr. Krajewski's questions that were directed to the coroner at the beginning of the 30.
I'd like to see actual where they're at today. When they
It's a general question for the entire budget, not just for the coroner.
where they project to finish the year at.
Any new business? Hearing none without objection, we're adjourned.